Welcome to Chapter 20. We are so close to the end of the semester, and this is the second to last chapter. It's a little bit bigger than the last chapter. It is the bigger unit of the final three, but we're still going to be covering the same things as far as those 5 important things you need to remember for each disease. That's going to be the microbe type, the causative agent, the transmission, reservoir, and then those unique signs and symptoms, the ones that stand out a little bit more, because some of these are going to sound kind of similar, but we want to look at the signs and symptoms that are more unique to those diseases. So make sure to be studying. Again, flashcards are made with the purpose of memorization, and that is what I want you to focus on. So memorizing all of this material is going to be for your benefit directly. So let's go ahead and get started with an overview of the digestive system. All right, we've got the digestive system, and most of this should potentially be a review for you guys. However, if it's not, fabulous. Let's learn from some stuff. So the digestive system, or gastrointestinal tract, or sometimes called the enteric tract, is essentially just a tube that goes from your mouth through your body, does a bunch of loops and spins and turns and fun stuff kind of around in your abdomen, and then there is an exit through the anus. So essentially all it is this gigantic canal almost that goes from your mouth to your tush. So what are some of those other organs that are associated with the digestive system? You've got things like your liver, your gallbladder. Those are really important when it comes to being accessory organs that will add fluids and enzymes. The pancreas is also included in there in order to assist in the processing of food when we consume it. So once it hits your stomach, there's a handful of things that are going to be happening. Primarily that stomach acid, we have chemical digestion that will be happening in the stomach. And then once we enter into the small intestine, kind of near the start of the small intestine, those accessory organs do release fluids and products of various kinds to aid in your digestion. So I would know a handful of these organs that are the primary players as well as accessory players when it comes to the digestive system. All right, so as we have discussed prior to talking about diseases, we've talked about where you find microbes on your body and also in your body. And remember that when it comes to the digestive system, we have a ton of home team players that exist in a beneficial or commensalistic relationship with us. Remember that beneficial could be like E. coli, which helps us synthesize vitamin K. Or maybe we have some bacteria living in our guts that don't necessarily benefit us. However, they are benefited by living inside of us. And then there, of course, is that negative relationship where you could run into various microorganisms that are pathogenic. So they're going to cause problems in our system. And sometimes they are still our home team that is causing problems. We'll talk about it as we get through some of the diseases. Now, there's a pretty good amount of defenses when it comes to our digestive system. So pretty much every layer, every surface inside of the digestive tract is going to be coated with a layer of mucus. So remember that this mucus could act as like a sticky trap. That's kind of going to go hand in hand with the way that we move food and solids through the digestive system through a process called peristalsis. It's essentially just like a squeezing of muscles. So not only are we moving food and fluids through our digestive tract, we're also moving that mucus that is going to have those microbes, and that peristalsis can dislodge as well as push the microbes out essentially eventually, because you don't want so many microbes that it's just overwhelming. We have to kind of monitor that through our body by kind of flushing the system every once in a while. Not a full flush, mind you, just enough that kind of lowers the amount of microbes. Now, we do also have two kind of important properties within the digestive tract, like our immune system. You have a different secretions that are going to be released by parts of our lymphatic system. So your tonsils, Peyer's patches, appendix, these are going to be structures associated with our digestive system that also are going to keep those microbe numbers down, as well as help fight those kind of naughty microbes as well. Kind of our first line of defense, that is part of our immune system. And there are also a handful of fluids that have a lot of antimicrobial properties, or just properties in general, that are going to kill microbes. Stuff like our saliva and stomach acid, really good examples, because those are going to be secretions that are very acidic or have enzymes in them to break down potentially organic material. It just kind of depends on what we're talking about. It should come as absolutely no surprise that within our digestive system, we have tons of microbes. Our normal microbiota are going to be a very large amount. So within the mouth alone, we've averaged somewhere around about 600 species within humans, about 128 within the stomach, even with that incredibly acidic pH as far as our stomach acid goes, and over 600 species, sometimes numbering in the billions as far as cells go in the large intestine. So this is not going to just be bacteria, because remember, our normal microbiota includes more than bacteria. It can be things like fungi or protozoans that are also going to live inside and on us. So keep that in mind, that in that channel or canal, the tube that goes from your mouth to your tush is going to be chock full of microbes. However, the accessory organs, that those four important accessory organs like our liver, our gallbladder, the pancreas, and I'm missing one, but it doesn't matter. Just know that these structures, I guess we have salivary glands written on here, so sure, we'll go with that one. Those four structures are going to be sterile. We don't want microbes growing and living inside of those accessory organs. But within the tube that goes from our mouth to our tush, that is perfectly fine. We want them there. You don't want them in the accessory organs. We will see that if they do grow there, that is going to be a particularly big problem. All right, to kind of wrap up that relationship that we have with our normal microbiota living inside of us, there are two kind of big important benefits that our microbiome living inside of our digestive tract help us with. The first is that our normal microflora will support a healthy weight. If our natural flora of our digestive tract becomes disrupted, there can be a lot of problems, a lot of fluctuations with weight, but usually tend towards obesity, actually, oddly enough. The other important factor is going to be that many of these microbes will help us with our digestion as well as the synthesis of various maybe vitamins or other items that we need. So vitamins like K and B12 are made by microbes. We can't do that in our body. We have to have those microbes that assist in that process make vitamin K and B12 for us. So if you have maybe a B12 deficiency, then maybe you're seeing that like you're bruising a little bit more. There may be an issue with your gut microbes and you may have to take supplements, but the hope is that your home team is helping you make those various items like vitamins, as well as to break down things that our body cannot break down without those microbes, like cellulose, which is what we get from plants when we consume them, of course. So let's get down to the nitty gritty. We got to talk about poop. I mean, we just got to say it because that's what we're going to be discussing quite a bit of in this chapter. So let's start with diarrheal illnesses. Now, a bout of diarrhea is going to be considered 3 or more loose stools in a 24-hour period, and that is what classifies it. So, particularly liquidy excrements is kind of included with that. Other symptoms you might see with these various diarrheal illnesses include a fever, abdominal pain, and or cramping, nausea, vomiting, and the big one, the one that we want to really take into account is dehydration. Depending on how many loose stool bowel movements the individual is having, they are losing water potentially at a particularly rapid rate. And that can be the big concern here when it comes to someone who has diarrhea. So, in order to treat, generally we want to try and fill this person up with fluid and electrolytes in order to make sure that they don't become dehydrated. Now, you might think that you need to stop the diarrhea in some capacity. In a handful of these situations with these various diseases that we're going to talk about, that is not something that you want to do. So there is a product called, I believe, Imodium. More often than not, you don't want to give this to someone who has diarrhea, depending on what is causing the diarrhea. We'll talk about that more here soon. Now, a diarrheal illness infection is going to be where a pathogen is growing inside of the intestines, and the incubation period is usually 12 hours to 2 weeks. So this is going to be a process that takes a lot longer for potentially symptoms to show up. Now, when we think of having diarrhea, maybe you associate with something like maybe food poisoning, something like that. Like it's instantaneously you are having toilet problems, right? That is usually what we associate as being called intoxication, which is the ingestion of a toxin that is produced by a microbe. And those symptoms appear very quickly, like between 1 hour to 48 hours after the ingestion of that toxin. So that's an instant response needing to go to the bathroom there, as opposed to the infection, which is going to take a little longer. So we're going to get maybe a little gross in this chapter, but hey, bear with me. It'll be fun. You'll be happy you did. When it comes to these particular types of infections that cause diarrhea, it is usually from the consumption of contaminated food or water. And that contamination, and make sure you know this, is someone else's or something else's contaminated feces. So that's right. That means we have a fecal oral cycle, essentially, where you have fecal matter being consumed and then causing the infection in that next person. So it can absolutely be a cycle that is always broken through proper sanitization, proper sewage disposal, being conscientious of where your drinking water is coming from, maybe not drinking out of puddles or something, that kind of thing, you know. But it's an important thing to keep in mind. However, there is going to be a little bit of a difference when it comes to diarrheal illnesses in the US versus potentially other countries. In the US, typically we see more so contaminated food. Our water is heavily treated in the US. So you're not going to see contaminated water be the causative problem typically in these situations. However, in other countries, it's usually a combination of contaminated food, but probably leaning more towards contaminated drinking water. Okay, we are going to start with acute diarrheal illnesses. So these are going to be sudden diarrhea. So these are going to be situations where we have a pretty quick response to that microbe that is causing the illness itself. Starting with salmonellosis. Tried to say that too fast, Rachel. Salmonellosis. There we go. That sounded a lot better. Typically, people just call this salmonella. However, but we're saying the same thing here. The microbe type is the bacteria Salmonella enterica. The reservoir is in humans and animals, and it can jump back and forth. Kind of keep that in mind. The transmission is the ever so tasty fecal oral transmission. So feces gets into maybe food or some type of product. That food is contaminated then, and then someone consumes it, and they are consuming feces. It can also be through indirect contact of contaminated poultry and eggs, as well as milk products. Also, handling some reptiles can also pass on this particular bacteria. Like if you're playing with your gecko or your bearded dragon or your snakes, I don't know what you do in your free time, and then you're playing with them with your hands, and then you go set them down, and then you go eat a sandwich or something without washing your hands. You absolutely can consume this particular bacteria through that process. Prevention is to eat pasteurized dairy products, as well as to cook your food properly. So basically just safe kitchen practices. And then of course, good hygiene is the next one. So washing your hands. Treatment will be IV fluids and antibiotics if the conditions are severe enough. Otherwise, you're probably just going to have to ride it out. This is one of the kind of classic food poisoning microbes that we will talk about. And when it comes to food poisoning, you should immediately think toilet problems, essentially. So diarrhea, vomiting. Because of the vomiting and diarrhea, there's a good chance that you could have cramps, like abdominal cramping, as things are moving very quickly through the intestines. We can also see a fever, and sometimes that diarrhea may contain blood. Not all the time, but sometimes. It just depends on how violent the situation is. Recovery is usually within a few days, and it has a pretty low mortality rate, but when we do see individuals dying from salmonella, it's usually due to septic shock caused by the endotoxin produced by the microbe. The next acute diarrheal illness is typhoid fever, and this one should sound familiar because we did talk about our kind of historical figure, but she's kind of infamous for what happened, and that is Typhoid Mary. If you need to recap on Typhoid Mary, she was a personal cook, I believe in the 1800s, something like that. We'll have to double check that, but who knows? It doesn't really matter. This isn't a history class. And she was a carrier of typhoid. So when she would go to the bathroom, she wasn't washing her hands, and then she would cook for these families and pass on this microbe, Salmonella typhi. So it is definitely something that is going to be passed from fecal oral transmission. That is kind of the primary transmission, and typhoid Mary is the way that I want you to remember that that happened, and also be a fabulous PSA to always wash your hands after you use the restroom, because you know, you can see from the image that these fun little microbes do have a ton of little flagella, and they are pretty motile, so they do spread throughout the body, which is kind of terrifying. And the unique thing, again, think of Mary with this, is that a lot of patients do recover and then become carriers. And that is kind of the concern, because they are still contagious if they're spreading their duties around, and feeding people, potentially without cleaning their hands, that they don't show symptoms anymore of having that bacteria. However, they are still able to pass it on. Prevention now is a vaccine, and also, I keep saying it, and I'm going to keep saying it, especially through this chapter, is safe food practices and good hygiene. Treatment, if it's bad enough, we do have antibiotics that will treat this bacteria. When it comes to typhoid, there are kind of a variety of signs and symptoms depending on where you are in the infection. So week 1 of the infection, usually we're seeing a high fever, headache, fatigue, malaise, nausea, possibly vomiting. The second week, things get a little bit worse, with the fever continuing, abdominal pain and tenderness, diarrhea or the reverse, constipation, and then rose-colored spots on the chest or abdomen. Once you get into week 3, if you're still showing symptoms, it is a continued fever, but it may start to come down, potentially delirium or confusion. We don't see this every time. Potentially also liver and gallbladder damage. So this can progress into more severe symptoms than just having toilet problems, because it can also turn into intestinal bleeding or perforation of the bowels. And when it comes to perforation of the bowels, that means that your intestines have kind of opened up into your abdomen, and you could start leaking the contents of your intestines into your abdomen, and that can become a particularly serious complication. It's pretty rare, however, it has happened. Next is shigellosis, which is a bacteria caused from the species Shigella. It produces a toxin called Shiga toxin, and this is going to be the problem child of this bacteria, is particularly this toxin. The reservoir is in humans and other non-human primates, so things like chimpanzees, bonobos, I believe orangutans, I could be wrong, but other non-human primates are included in that. Transmission is fecal oral, as per the protocol that we have discussed a few times, and direct contact. The ingestion of as little as 10 cells, essentially, can lead to an individual getting sick. So it's a pretty efficient little microorganism. Some signs and symptoms that we could see with shigellosis is bloody diarrhea. We also call this dysentery. If you ever played the Oregon Trail, you know, dysentery was one of the ways to pass on the Oregon Trail. Fever, nausea, vomiting, abdominal pain, and cramps. Recovery could take a few weeks, and the mortality rate is now substantially higher than we saw in Salmonella. So shigellosis is a little bit more serious of a situation as far as a diarrheal infection. So we are seeing that because of that Shiga toxin, it is particularly more concerning because it does cause inflammation and bleeding within the intestines. All right, so some prevention for shigellosis is food safe practices. Don't drink lake water because that is a commonplace for this little guy to exist, potentially because people are contaminating the water. Think about it, don't think about it, just don't drink lake water. Make sure that you are drinking non-contaminated drinking water. Kind of an odd one, but avoiding sex with someone who has had diarrhea can potentially pass this microbe from one person to the next, and then potentially getting a contamination from soiled diapers. So proper diaper disposal is very important for like 100 reasons, but add this to the list. So throwing away soiled diapers in a lined garbage bin that also has a lid. So keeping everything nice and tight and packed away would be nice. Treatment will depend on how severe your symptoms are, which those symptoms may get particularly severe. And again, when it comes to various diseases that have diarrhea as that primary symptom, we want to make sure that we are treating these properly because we don't want the individual to become dehydrated. There are certain things you don't want to take, like Imodium or Lomotil, because these products will stop you from pooping, essentially. They slow down the bowel function, which means that this bacteria will stay in your system for a much longer period of time. So the thing you want to take is something like Pepto-Bismol. So something that has bismuth in it is a good product to take with this. It will relieve some of those symptoms, but it will not prevent you from being able to go to the bathroom and get that bacteria out of you. That is the hope, that is the goal. Making sure tons of fluids are in this person's system is important because, again, they are having diarrhea. That fear of dehydration can become very real. And if things get particularly bad, possibly antibiotics will be the next step. Otherwise, kind of like with most of these conditions, you're going to ride it out because that's kind of the best move, the easiest move, and that's just the way it kind of goes when it comes to essentially something like food poisoning. Now, our next disease is technically someone you've heard of, and that's E. coli. So Escherichia coli, which we fondly just call E. coli, and you can just remember it as E. coli. There are different strains of E. coli, and essentially this is just a particularly large and diverse group of bacteria to begin with. The strain of the bacteria E. coli that lives inside of us usually isn't going to cause a problem if it's in our intestines. If it moves, then, then that's an endogenous infection. This is not that. Make sure you know that. This is a different strain of E. coli that produces the Shiga toxin. That is the problem. This guy is an issue. So it is a bacteria. It's a strain of E. coli, but specifically, and know this, it produces the Shiga toxin, and the toxin is the issue. The reservoir is humans and animals. Transmission is ingesting contaminated or undercooked meat, but it could be food and drink are also a possible transmission as well. It's just contaminated products with this E. coli that has the Shiga toxin, specific strain of E. coli. The prevention is just food safe practices. Don't consume raw meat or poultry. I don't know a single person at least not in my life, who openly does this, who eats raw chicken, but don't do that. It's not better for you in any way. Cook that stuff. You need to be safe to prevent yourself from spending multiple days on the toilet and potentially going to the hospital. So food safe prevention, don't consume unpasteurized milk or ciders, unclean fruit, vegetables. You gotta clean everything, essentially. Don't immediately get it out of the package. You should be cleaning everything before you eat it, or cook it, and that usually kills any microbes as well. So treatment there isn't one. We can't treat this with antibiotics or antidiarrheal medications. So it just increases various risks. And we'll talk about this HUS in a minute here. So just give me a second. It's going to be on the next slide, I promise. And then potentially, in order to prevent that dehydration, we will start looking at IV fluids. Okay, here's that HUS. I didn't want to say it until you could see it on the screen here. So it's hemolytic uremic syndrome. So what happens with this is individuals will suffer from an inability to urinate, loss of blood flow to cheeks and face, overall tired, weak feeling, anemia, lowered platelet and red blood cell counts. And eventually it can damage the kidneys, which could lead to kidney failure. So this is why we do not treat this particular bacteria with antibiotics. So that is kind of the big thing, or antidiarrheal medication. So some signs and symptoms that we could see aside from HUS is fever, bloody diarrhea, abdominal cramps, vomiting. There could also be neurological symptoms like blindness, seizures, maybe even a stroke. So this one can be pretty serious as far as our acute diarrheal infections. All right, so our next acute diarrheal infection is Campylobacter. And fun fact, this is one of the most common causes of diarrheal illnesses in the United States. Now, for the most part, most cases occur pretty isolated. They're pretty sporadic events, and they're not usually part of an outbreak. So they're pretty select. So the causative agent is a bacteria called Campylobacter jejuni. The reservoir is usually poultry, cattle, pigs, and sheep. Transmission is the ingestion of those contaminated products. So potentially unpasteurized cow's milk or undercooked chicken. Again, I cannot express this enough, guys. Make sure that you're cooking your chicken all the way through. You don't want it medium rare because you can get Campylobacter or a handful of the other different conditions we've already talked about. As well as infected stool from pets can also be a transmission of this Campylobacter. Now, we do kind of keep bringing up how many cells you need to consume to become sick with this infection. And I would potentially know that as like a little side piece of information. Ingestion is fewer than 500 cells of this particular bacteria. Prevention is, drink pasteurized milk, so processed milk. Louis Pasteur didn't give his life to that study for nothing. Fully cook your meats, especially your chicken, and avoid those contaminations. So basically like safe food practices and good hygiene is the big one here. And you're going to notice that is almost always the prevention when it comes to these various acute diarrheal infections. Treatment, fluids for dehydration, antibiotics for individuals who are more at risk, who may be like immune compromised, or particularly young or particularly old. It just depends. But we don't usually treat this with antibiotics if we can help it. Okay, some signs and symptoms that we might see with Campylobacter is fever, diarrhea, possibly blood in the diarrhea, abdominal pain and cramps, which is again very normal for a diarrheal infection. But we also see headaches that could last a week, but sometimes over 2 weeks for these various symptoms. Now, the odd symptom we might see is that very rarely, 1 out of 1,000 cases, can lead to Guillain-Barré syndrome. And if you remember that term, it might be itching at the back of your brain like, oh, I remember you saying this, but what the heck is it? Remember, it's that kind of weird paralysis that can come up in different infections. We talked about it with Zika virus. So it is that leading cause of acute paralysis, but it is a very rare symptom to see. Next up is one you have probably heard of and hopefully haven't smelled. If you have, you know exactly what it is. It is C. diff infections, or a infection caused by the microbe Clostridium difficile, but we just kind of fondly call it C. diff. It is a bacteria. The reservoir is humans, and the transmission is essentially a superinfection that grows in our intestines after taking antibiotics. So the kind of concern that happens is that C. diff is naturally in our intestines already, and that's not the problem. It's entirely that after taking antibiotics, that maybe as a broad spectrum antibiotic, it kills all of our other home team bacteria within our intestines. And what this does is it opens up a bunch of real estate and resources for C. diff to grow. So it grows and then releases toxins that eat away at our intestinal lining. And that is the problem. You may see perforation of the bowels when it comes to this particular microbe. And remember, when it comes to perforating the bowels, that means that feces escapes the intestines and goes into the abdominal cavity. And that is the thing we want to avoid. So prevention is good hygiene, taking antibiotics as prescribed. It's, people don't listen or follow instructions very well. So, I don't think it's a bad thing to let people know that this is a possibility that could happen, and, follow instructions, because you don't want this infection. The treatment is potentially fecal transplants to try to get microbes back into the intestinal tract. This can be taken in a handful of different forms if you're really into learning about fecal transplants. Usually it's like dried out fecal matter that you consume in a pill, essentially. At least that's what I have heard, more so than, we don't have to talk about it. Essentially, that's what a fecal transplant is. So some signs and symptoms. Because that C. diff is going to produce that toxin, it is going to affect the intestinal wall, like I said, and it does have the potential of perforating the bowels, and this can lead to death. Now, in some cases, because of that toxin, the colon becomes inflamed, and what this does to the inner lining of the intestines is cause it to slough off. So it starts to come off like our skin on the outside of our body. That is what we also use that term sloughing for. However, what this does is it creates these membrane-like patches called pseudomembranes. And here are a couple pictures of, I think that first one is no pseudomembranes, and then I think we have the development starting to form, and then we have that pseudomembrane starting to form there. And this is going to be where we get a lot of the smell when it comes to C. diff. Now, there shouldn't be a favorite microbe or diarrheal infection for anybody ever, but I'll be real with you guys. This one's mine. I think cholera is kind of interesting, especially when we look at a lot of the history when it comes to epidemiology. Um, so we'll talk about it. So first and foremost, cholera is again another acute um, diarrheal infection. It is caused by the microbe Vibrio cholerae, which is a bacteria, and it's actually pretty common in underdeveloped countries. And the issue with this bacteria is that it also produces a toxin called the cholera toxin. So you'll notice that we're starting to get into these various microbes that produce these toxins, and that's where kind of the bigger problem lies. Not the bacteria necessarily itself, but what it's producing. So transmission is ingestion of contaminated water. Um, so it is a fecal oral transmission. Now, one of the kind of interesting things is that there's been a handful of cholera outbreaks around the world through history. There was actually even one in St. Louis, so pretty close to home, and it was because of the drinking water becoming infected, I think, from the river. It had to do with what we did with our sewage, and where you got your drinking water was the river, and if you're contaminating the river with your sewage, you're drinking your poo-poo water, essentially. So, one of the most interesting cholera infections, I think, in history was the 1854 cholera outbreak in England, and it was linked back to a little girl who was sick, and at that time, how you got rid of fecal matter and diapers was to throw them into your cellar, essentially, or underneath your house. And so her contaminated feces, which was essentially just diarrhea, was mixing with the groundwater in that area, and it leaked into the water table that fed this particular well. So this guy named Jon Snow, different from a very popular show and book series, Jon Snow was trying to figure out why all these people were getting sick with cholera. What started this outbreak essentially in 1854? And he linked it back to where people were getting their water. So he was investigating, like, who'd you talk to, who were you with, what'd you eat, where'd you get your water, what'd you drink. And all these people were saying, well, we got water from this particular pump in the middle of town. And all he did to stop the cholera outbreak was removed the pump handle from that particular well. Because initially he removed the bucket, I believe, and someone else brought a bucket and just replaced it, and we still saw people getting sick. But he removed the pump handle, and because maybe people are lazy or something, they didn't use the well and they used something else. Well, what ended up happening is people stopped getting sick, and that was what kind of gave Jon Snow the title of the father of epidemiology, essentially, because he was looking at tracing this infection back to its source, which is kind of an interesting thing. And that is something that makes cholera, I guess, arguably one of my favorite of our diarrheal infections, just because it has such a neat little backstory. So, for prevention, it's obviously just not consuming contaminated water, essentially. So, properly treating sewage so that water does not get contaminated, and then purifying water. There is a vaccine for cholera in areas that are more prone to it. Treatment is fluids and antibiotics. Some signs and symptoms: vomiting, diarrhea, and specifically, kind of the unique thing is going to be this description of stool when it comes to this infection, and that is rice water stool. Now, what it is a loss of the mucus within the intestines because you have such violent diarrhea. You are losing so much water that it's causing that mucus to come out of your body along with all that water. So there's essentially no feces left in your body. All that's left is the infection, that toxin, that cholera toxin, is pulling water out of your cells into your intestines, and then it's taking that mucus lining with it. And so what it looks like is rice in water. And so at that point, you are losing so much water that you're going to die of dehydration. Your organs are going to start shutting down. You have a low blood volume because, again, water is leaving your body like it has to get out now, which is kind of just terrifying. So what we see with cholera, if it is not treated, is potentially death within 48 hours because you have such violent, intense, consistent, continual diarrhea. But again, it stops being diarrhea at some point, and it's just your body having water leave your body, which is just terrifying. So the mortality rate of a cholera infection is between 55 and 70%, which is crazy high. Crazy high. But yeah, cholera. There we go. Next up is a vibriosis infection. So vibriosis or Vibrio species do not cause cholera. It's a different species of bacteria. This is more common in the US than cholera is. So Vibrio or vibriosis infections are more common than cholera because we don't have that contaminated water usually. But the thing that makes Vibrio kind of unique is that it's a contamination of seawater or contaminated shellfish that were living in contaminated water, and then you consume that seawater or you consume that shellfish. So there are 3 factors that kind of tend towards we are seeing Vibrio being a little bit more common. There's an increased demand of shellfish, increased awareness, and then global warming is also becoming kind of a bigger thing. I realize I just kind of skipped over the increased awareness. We're essentially able to diagnose this better and know precisely what is causing our symptoms with Vibrio, this particular infection. So we are diagnosing it properly as opposed to we were kind of passing it off to like maybe it's something else. So, and then global warming is creating a better habitat for the bacteria to exist. Now, if you are a particularly healthy person and you consume this bacteria, you're probably going to be fine. You may have a bit of discomfort for a while, but it's individuals who are immunocompromised that is the concern with this particular infection. All right, on to Cryptosporidium infections. The microbe type is a little bit different than what we've been talking about, and that is a protozoan instead of a bacteria. It is caused by Cryptosporidium protozoans. And what's kind of weird about these protozoans is they can undergo encystment. And remember, that's kind of like creating like little safe space for themselves. And it just makes it incredibly difficult to get rid of this protozoan. It makes them very hard to kill. Not to mention, protozoans are the same cell type as us, so they're also hard to treat just in general because of that. Multiple things make them difficult. The reservoir is humans and animals, especially livestock animals. The transmission is usually the ingestion of contaminated food or drinks. So the thing you should kind of think of is that if you've got livestock or livestock are nearby, There's a good chance they could be carrying this protozoan, and, they're hoofing around in their paddocks in their own feces, essentially. So if they jump in the pool with you, like this adorable cow here, and then you get in with them and then accidentally, do a cannonball next to Betsy here, then, you might be ingesting some of that contaminated feces. So something to think about there, because the chlorine, if you use chlorine, probably not great for your livestock, but probably not a good thing. That chlorine is not going to destroy the encystment that surrounds the protozoan. Now, these signs and symptoms can last for up to about 2 weeks, where you have a fever, diarrhea, severe abdominal pain and cramps, headache, sweating, vomiting, very classically a diarrheal infection. Prevention is using clean pools, good hygiene, food safe practices, and the treatment is an anti-protozoal medication, and making sure the individual does not become dehydrated. Now, with that, guys, we will stop here, at least for this first part of chapter 20. Stay tuned for part 2, and we will finish this chapter up.